Hunter is an epidemiologist and professor in medicine at the University of East Anglia. He joins us now from Norwich in the UK. Thanks so much for being with us. You know, it would seem like a no-brainer that since we're still in the midst of this pandemic, large gatherings would still be banned, but they're not. So do you cringe when you see images from mass protests, for example, knowing how dangerous this virus still is?
Absolutely, and I think it's probably only going to get worse as we move into winter. Risks outside are much less than they are inside, and if we are going to be having a lot more events indoors as the weather gets colder, then the risk will certainly substantially increase.
It's interesting that you mentioned the difference between inside and outside. It's those indoor events specifically, because I've seen people gathering at rather large events outdoors, particularly in warmer climates now between Europe and Turkey and the Middle East, where we haven't seen outbreaks happen, even though there are dozens and dozens of people in close contact. So it really does make a difference to have specifically those indoor gatherings addressed, does it not?
Yes, indeed. There was a study from Japan, I think, only a couple of months ago, which suggested that you were 19 times more likely to spread the infection indoors than the same sort of exposure outdoors. So I think that is going to be a very big concern, particularly in more northerly parts of Europe when the weather turns colder, as it will do within the coming weeks.
Any day now, yeah. Tell us, though, in general, how common are these super spreaders, the ones that don't even realize they're infected, but for some reason are so highly contagious and can manage to infect, upwards of a dozen people from one event? Yeah.
Yeah, well, it's not always the person. It's sometimes, partly it could be that they're actually shedding more virus than other people. But partly it may be actually just the context that they're in at the time that they are most infectious. They just happen to be around with a lot of people. They may be in a choir or something like that. We don't quite know exactly how many super spreaders there are, because often they go undetected. But there's been some reasonably good research which suggests that perhaps up to 80% of new infections are in fact spread by only about 20% of people who are infected. So there is a big discrepancy between who gets infected and then who might then pass the infection on. And those that do can spread it to quite a large number of people. Right.
From all the research you have seen, though, and your experience as an epidemiologist, and also knowing what vaccines might be on the horizon, what's your feeling? When do you think we will be able to again attend gatherings in the way we used to?
I think this winter is going to be very difficult. I think even if a vaccine does become available, it's unlikely to be widely available before Christmas. I think certainly in the UK, people are predicting that we're going to see a peak round about December, January, after which cases will decline. And I suspect whether or not we do have a vaccine that's effective, things will be getting back to normal by about April or so next year.
Okay. Paul Hunter, great to have you. Thanks so much for being with us on TRT World.